I'm so sorry. Okay, one last time, because you wanted me to talk to you after I talked to the social worker.
Good morning. Good afternoon. Dr. Patel.
Dr. Patel. Yeah, she's your attending. Okay. So I just wanted to clarify so that there are no more doubts, because, I think you're getting kind of mixed messages and you're kind of...
Yeah, that was the whole thing.
Yeah.
Like, I just wanted somebody to talk to. Nobody was talking to me.
Good.
I'm walking around getting followed by security. I can't take my baby. I can't do nothing.
So this is what you told me earlier, that you are concerned about the risk of the lumbar puncture on the baby, and since there is a reasonable alternative, which is treat anyway with antibiotics for 2 weeks, you're okay with that? You would rather do that?
I mean, I'm not okay with that because, you're still not sure if that's
We
the
need to see
infection.
some results.
So the placenta, I just spoke to the pathologist. Your placenta is showing acute, which means active chorioamnionitis and what we call funusitis. Your placenta is stricken with infection.
It's stricken with infection. But was this before or after that my baby was forced to void his bowels
So meconium doesn't cause this.
Meconium doesn't cause it. Okay,
Correct.
so what causes it?
So it's, as I was telling you yesterday, it is the nature of the placenta, the amniotic fluid, the process of labor. That's why we have this diagnosis even exists.
The process of labor causes infection.
So the fact that you can have bacteria that can transcend from the vaginal canal into the amniotic fluid and affect the placenta.
Okay, all right. Skip all this. The infection that the baby about. How is it, being treated? Is the treatment working?
Yes, because that number that I told you, that CRP number that was 119, which is normally 3, has started coming down.
All right, that sounds good. That sounds lovely.
But the treatment, to complete treatment, is either the lumbar puncture or it's 14 days.
The lumbar puncture was to see if he had an infection in the brain and the spine.
Right, but if because if there is no evidence of infection in the fluid that is surrounding the brain and the spinal cord, then I can treat for 7 days. If there is infection, then I would have to treat for 14 days. If we don't know, it is a completely appropriate alternative to not do the lumbar puncture, but then the baby needs 14 days of treatment, because then if the baby has meningitis, he is not getting the full treatment, and that can result in death.
So there's no other check for meningitis but the lumbar puncture.
Correct. Because that's the only way for me to examine the fluid that is there where meningitis occurs.
Well, I would like to get a second opinion, honestly, so.
A second opinion from another physician here, because there's been 3 physicians involved.
Not at all
So,
from here. I would like to move my child from this NICU facility, because I don't feel comfortable. The security, I still haven't gotten an explanation as to why the security.
Let's keep things one at a time.
No, this is all connected.
No, she was just about to address that. Could you please address that for me, please?
So the reason that security had been there in the beginning when the baby was first admitted was because you had said things while you were in the NICU that you were
while I was
all of
under.
That is fine, but we take that extremely serious.
While I was under a bunch of medication that I wasn't ready for. I was being threatened.
Aware of post-traumatic stress and what that entails. And
I can
postpartum depression, everything that's included with giving birth.
Anytime somebody
I didn't threaten. I'm sure I made no threats at all.
Statement. Did you say?
Anytime somebody threatens that they are going to be removing and pulling off things from a baby in the NICU,
I never said nothing like that.
When did you say that?
I hope you got this in writing, because that is crazy.
So that's the basis.
That's
of all
the basis.
This, then. They said that she said that.
Someone told you that. I would like to know who said that.
This was done at the time, but when the baby first delivered, came to the NICU, and you initially came.
And I did. Okay.
You don't remember saying that?
No. I remember everything.
What she said. Well, she never said nothing.
I never said anything.
Ripping the IVs off or anything off the babies.
I said that I myself would leave. I never said anything about my child being taken from medical professionals for any reason. I never, even after you got us the refusal signed from both parents. Listen, both of us signed a refusal for the vitamin K shot, and she ignored that and gave my child the.
Let's keep things.
This is all in the same. Now you're okay. You're right.
Gotcha. All right, so that's the case. So that's the reason for that. Someone said that she was she wanted to hurt the baby. So that's
okay.
Not threatened to remove everything. I'm not saying that you said.
I didn't say that at all.
I hear you.
I didn't say that. Let's get that out. I didn't say that at all.
Okay,
that's the reason for it.
You're saying so the infection that the baby has, so when based on the blood work that you do, when his blood work for the CPR returns to normal, isn't that another way of telling that the infection or his state has normalized?
So it doesn't work quite that way. The downtrending is what we look for, but the research in looking at bacteria and how long it takes for bacteria to die with an antibiotic, that's where these numbers come from. So 7 days if it's not affecting the brain, 14 to even 21 days if it's affecting the brain. Given all of his other clinical presentation, that's why I'm saying the 14 and I'm not saying 21. In some situations it would be 21, but that is not the clinical presentation with your son.
Yeah, but even with his brain, like, there's nothing wrong with, like, he's progressing so well. He's breastfeeding, he's so lively.
He's 2 days old, and he's doing everything on his own already.
Like,
everything.
You know, the only thing is just the IVs.
That's the reason he's not getting 21 days. It's those reasons that he's not getting 21.
I don't think he's going to need any of those days.
Listen, I'm scared of the lumbar thing. Because that could introduce even a new infection.
If there's no infection at all, that procedure can introduce infection.
So it's done in sterile procedure.
I understand that, but even under...
And from my understanding, the baby has to stay still. Like, what normal baby are you going to get to stay still while your puncture is fine?
You strap them down?
We don't strap them down. We hold them. So we hold them in a gentle position. We give them the sucrose, so the sugar water that is known to help calm a baby. And we can even dip with breast milk as well, with the pacifier. That is actually shown to calm a baby. I can tell you that having done this many, many times, babies actually tolerate the procedure very well. They're actually very calm during the procedure because they're held kind of in that
as long as
position.
So isn't it painful?
Yeah.
The puncture
it's a prick. So the way that you would feel a prick when you would first get a little stick, that's the only pain he feels. There's no additional pain once we have entered the spinal cord.
And it goes through the tissue into the bone.
Not into the bone. I can't go into bone. So what we do is there's a spinal cord, right? There's the vertebra, and there's spaces in between that. Based off of various landmarks on the body and where I feel, we go right in between that opening space. It lets me get into the fluid that is below the spinal cord. I'm not going anywhere near the spinal cord. I go below the spinal cord in order to get the fluid.
Man, this all seems pretty scary to me.
It is. It's very scary.
I understand that.
It's very scary. And like I said, I would just love to have the alternative of seeing another doctor. And that's my option. That's what I'm going with.
This is what I'm going to say how the transfer process works.
All right.
There is the Maryland Regional Neonatal Transport System that is affiliated with the University of Maryland and Hopkins. When I'm done rounding on the other babies, will call into that transport system and explain the clinical situation.
Well, you can give me the paperwork.
It doesn't work.
Well, I need some numbers so I can talk to someone else. Because I'd appreciate if you were not, a part of his plan anymore.
I'm the physician that is here, and
that's why I'm trying to get my baby out of this hospital. That's the point.
I understand that, and we a NICU has to accept the baby, and the only
we will figure that out, definitely.
Just do what you have to do and let us. I prefer an African American doctor if that's available.
I'm sorry, we don't have an African American physician that's here in our.
No, you said I would like from a different hospital.
You can't. So it's whoever is working.
Yeah, no, I just said preferably if that's available.
Sure, I don't know which. So the way that it works is either the University of Maryland or Hopkins is on for transports, for transfers. I will explain the situation. Many times they are at full capacity and are not able to accept a patient unless the patient is. We will try. We will 100% try.
It doesn't sound like you're going to try.
I am going to call.
If She says she's gonna try.
All right. Well, I need it to be done. I don't need it to be tried or delayed even longer. I need my son away from this situation.
And as a medical supervisor, you say you're the supervisor for the NICU, right?
I'm one of the NICU doctors, but the supervising physician has also been, the head of their NICU has also been involved in it.
Yeah, so as a supervisor, a person in that role, how could you not, adhere or wishes to the case shot and the prick? How could you think that was a misrepresentation? We sat in the room and had a detailed conversation about it. You brought us as a form so we could sign against that, and then you still had a misrepresentation against that.
I understand, but based off of the comments that Mom had made, and Mom had verified that she had said, if I just agree to this, is all of this over? And
Because
she made that comment, but she didn't agree with it, or she asked you a question. She asked you a question.
I understand that, and my follow-up back and forth, I misunderstood the situation. But at that point, you were also, by the psychiatrist,
You weren't in your right state of mind, like you said yourself, in the postpartum, very.
so I'm no longer a parent.
He wasn't there at that time when we were talking to you.
I didn't say that. I said that yesterday.
My concerns no longer matter when
I didn't say
I'm depressed.
I said that you weren't in your right state of mind the other day when I saw you. That's why.
So my child gets unwanted treatment.
It was actually prior to that. The doctor had deemed you unable to make medical decisions for your child at that time.
So anybody can make medical decisions for my
the
child.
doctor deemed her unable to make prior medical decision. Who else is second to make the medical decisions for the baby?
Then
You did it.
And why wasn't I consulted?
at that point, there wasn't a birth certificate that was signed. You were not deemed as the father because the birth certificate had not been
Was the
signed.
case shot that urgently that we couldn't wait for the how was it urgent?
Because we had a window in which it works. If you delay that, then
So it didn't have anything to do with the comment that I made. You had a window to make, and that's why you gave him the shot.
that is not what I.
That's what you just said.
That is not what I.
All right.
So why you didn't even tell us all of that?
Yeah. No. She never
You
said
just left
that.
the room and let us
Oh my
me having
God.
one impression, and then now I'm hearing all this.
I do not deem whether or not a mother is fit to make a medical decision. This doctor has done that after meeting with you.
All right.
That's all I can say. That is not my role to tell. That is not my role.
All right. Well, I appreciate you guys coming ahead and let
But
us know.
we made the decision together.
Yeah, we did make the decision.
I was
He
there when
signed,
she
you
asked me the
allowed. He
question.
was a father
I was there,
when
and
you needed his signature on a piece of
I
paper.
still denied it, even though you say okay, rule that out. She was unable to make the medical decision at the time. I was there, and I still ruled it out. And my
What was this about?
This is the vitamin K shot that, and because of the baby's concern of hypoxia, because of the prolonged decelerations, parents didn't. They had declined the vitamin K shot.
Okay.
Prior to your evaluation, I was trying to.
So it was
explain to them before I knew his final assessment of you. I was trying to have a conversation with the parents to see if they would
But
agree.
that was necessary, right? I mean, he received the shot and
He
it's
did.
fine now, right?
Yes.
So
He's not
it wasn't
fine.
necessary. It wasn't
Yes.
necessary. The
How
shot
do we
was
know it's fine? It
optional.
probably
Why are you
would
saying it's
introduce
it was
infection
optional?
into him.
She said it was optional. She didn't say it wasn't necessary.
You said it was not mandatory. Why would we get a refusal slip if it was
Mom, I have never used those words.
I'm sorry.
I have never used those words.
listen, let's try to stop arguing about what it was.
No, we're not
So the
arguing.
plan
We're
is
just
now
trying to
she's
get it
gonna go
clear.
call the
Okay, yes,
officer,
to
Mary,
find another
Mary,
NICU,
any bed
a
over
safer
there.
place for my child.
Okay, now do we about the antibiotics, right? So we said it's either
Y'all don't.
of antibiotics.
We don't need to discuss this any longer because we're going to find another
But
hospital.
what if
No,
there is no other hospital?
it will be. It definitely will be. It needs to be.
Let's finish making your statement from it,
Yeah.
please.
So, do you want to do the lumbar puncture and then we'll see if it's 7 or 14 days, or you want to proceed with 14 days?
No, we want to consult another. I
Yes.
still want a second opinion because I'm not sure about it.
Even if we
I
have
want
to
second
find
opinion
a
from
personal
doctor.
care
It's
doctor.
different.
Until we get that, we're going to proceed with antibiotics. Is that?
Yeah, because that's the current treatment, right?
Exactly.
Okay, and one more question. My impression was, so he's under the IV for the antibiotics. Someone told me there can be an at-home nurse that comes in and administer the antibiotics.
Because for babies, oral antibiotics doesn't reach the therapeutic levels in the blood.
So-
babies need IV antibiotics, and no home nursing would feel comfortable with maintaining an IV.
How do you know that?
Because I've worked with the home health nurses. They only
So you work with every home health nurse ever?
Every agency that's in the state.
I'm pretty sure. Okay, I will look into that myself.
And if you find somebody that
All right.
to take
Yes, indeed.
responsibility,
And best believe I
So
will.
you said orally it's not effective.
correct.
So and the IV can't stay in the baby. So you said maintaining it, so the IV would be there, so they don't feel
Because
safe.
the IV can come out, and nurses are not always, they won't have the ability to necessarily put an IV right back in. Any delay in getting the IV, if the IV falls out, any delay in getting the IV back in would prevent the baby from getting the appropriate antibiotics at the right times, and then the therapeutic levels in the blood would decrease.
Okay, so what about someone who knows how to do the...
Again, if you are able to find somebody that is willing to, that has medical licensing, that is willing to take responsibility as a medical physician and as a nurse to administer and order IV antibiotics at home.
Well, I mean, not a nurse, but someone a little bit higher than a nurse who is qualified to do
There
this.
isn't such a thing that exists for babies.
Okay,
That's
what
all I
just
can say.
want.
Yep.
Okay.
That's all I can say.
Okay.
Okay, so will you let them know as
Yes.
soon as
Wait. So I was just thinking, as I had a couple of questions I just
Sure.
wanted to ask you. I just want to make sure I got everything out.
Sure.
So we're all on the same page. So, okay, so that's that. So now you're saying, the continued method of treatment. So even, say for instance, 5 days into the treatment, his CPR and white blood cells level,
Are normal.
return to normal, and that's not enough sign to take him off of 14 days of treatment.
Correct.
Right?
And the reason is because although those things are starting to normalize, it takes 7 days or 14, depending on which way we're going, to know that we have fully treated the infection. Because otherwise what happens is there can be a period in which those things are normalizing, but because we haven't completed treatment, if we stop it too early, they're going to go back to being abnormal again.
Okay, and what about his blood work? She said they were monitoring to see if there was a bacterial growth in the blood work, and so
And that
far...
is the other reassuring thing. So you can have two ways of infection, like I was describing yesterday. There is a type of infection that creates a response in the body with the CRP and the white blood cells, like what is abnormal with GO. That is one type of infection in which the bacteria doesn't actively grow. The other type of infection, which is much more serious and would probably have him acting more sicker, is the one in which the bacteria actively is growing in the blood. Fortunately, we have not seen any of that bacteria growing in the blood. So he isn't having actual bacteria growing in his blood, but his body has responded to an infection based off of what his abnormal labs are.
So since there's no bacteria in the blood, wouldn't be that to safely say that there wouldn't be no bacteria infection in his brain?
Not necessarily, because there are 1/3, so 33% of cases have meningitis with a blood culture that is negative.
33%. Okay. So you say with the blood work and the white and the CPR, so that's not enough to tell that the treatment is successful. It's just
You
enough
have
to say that he's
complete
progressing.
You have to complete the full treatment to know that any of that infection has been taken care of, because as I was saying, it can normalize, and then if you stop the treatment too early by not completing the 7 or 14 days, without that continued therapeutic levels in the blood, the labs will again become abnormal. But if you complete the full treatment, you have reached the therapeutic level in the blood for the full duration of time, and then your blood work will remain normal after that.
Okay. Alright, I'd still like to get a second opinion.
Absolutely,
just
I
for
will
this.
call.
So
I will
you
call.
said, so it's already been 3 days already?
So we're at the 48-hour mark this morning.
Oh,
So
for the baby,
48
2
hours,
days.
yeah, so 48 hours of the negative blood culture.
Okay. And if we were to get the lumbar puncture, these 2 days will be added to the 7 days, or would be additional
It
7
would be
days?
added if
An additional 7 days
if
of
everything
treatment.
is normal, yes. If everything is normal. So if there is no concerns of infection in the lumbar puncture, then we do 7 days, and it would include the days he's already gotten. If we do 14 days, it will also
Which the
include...
two, you say the
They
2
count.
for
Yes,
48
it's
hours,
only,
okay.
we only have to restart the count if it's abnormal.
Okay.
Because then we have to make sure it normalizes and then treat the baby.
All right. Yes, I would like to get a second opinion.
Absolutely. I will call and I will let you know which hospital.
And meanwhile, we'll continue with the
With the antibiotics, right?
Okay. Good. Thank you.
Thank you.
Thank you.